Hello and welcome. Thanks for joining again. Your time is certainly valued, appreciated. I know you could be spending it elsewhere, but if you came here for some excellent educational tips and tricks, want to learn, embrace your spirit of inquiry, come to the right place. Short, sweet, simple explanations that are broken down. Okay. It's definitely not elaborate or fancy, but from a nurse educator, this 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 will help you achieve your best in nursing school. So let's talk about it. Today is the anatomy of a stethoscope. Now, just as a mechanic, right? They can't fix a car or a truck or an airplane or many other aspects for that matter without, you guessed it, proper tools. Okay. So tools that are in just like a mechanic's toolbox, what's in our nursing bag, right? Stethoscope. Okay. Comes in many shapes, patterns, colors, all kinds of stuff now. Um, so this stethoscope I've had for a few years now. It's probably time for an upgrade, but I can't part ways with my Littman. Just can't do it. I do love the Littman. This is the classic Littman Classic 3 stethoscope. I'm not paid to endorse Littman. I've just used it in clinical practice for a few years and absolutely love it. So a stethoscope does not magnify sound. No. Think of it as a microscope for sound. Okay. It blocks out everything else in the world that's happening so you can hear or auscultate, right? Because you're a future nurse or a nurse now, right? So it's integral to have your stethoscope in good working condition. You may want to care for it in a nice package. Okay, personally, I keep mine stored in here. Okay, there's a few other tools in here, but as you can see, they're not cheap, and cheap probably is not the best quality. So, anywho, and there's many out there, very lots of them. So let's get down to it. Oh, hi, honey. Can you go over there for a minute? Thank you. Okay, thank you. Okay, sorry. Um, wife, uh, excuse me, mom, wife, nurse, right? Here we go, nurse educator. So, and thank you, honey. So, what do we have here?
Dr. Kim.
Thank you. Okay, so now let's
Okay.
let's talk about the stethoscope. Okay. Now, the smaller portion, now not all stethoscopes are made the same, right? But let's discuss it at depth. This type of stethoscope has a bell, okay? Small. See the girth is small. And then it has also, if you look at the larger, wider portion, a diaphragm. Okay. So the bell, and again, very basic anatomy of a stethoscope here. Bell, diaphragm. You need to make sure, see what I'm doing? I'm twisting the tube, and there's usually a little indicator. See right there? It's kind of a notch. When I twist it, it goes away. When I twist it, it comes back. Wherever the notch is the area with active sound that you'll be able to auscultate or listen or hear. Okay. Now your stethoscope should be, you have your pierces, pieces. Can't even talk tonight. Your earpieces. Now, if you notice, they're not flat, nor should they be. They should not be flat. Okay, they should be pointed upwards. If you're holding it flat like this, these earpieces that go in your ear, very soft, they are replaceable, but they should be pointed towards your nose. So out, out, okay, in the ear. I can't hear you. I have my stethoscope. Everything's drowning out. Okay, so if you touch this with the ears, with the earpieces in your ear, it's going to be very loud. Okay. So again, you want to make sure. I see in a lot of nursing students, they get nervous. We all did, right? I remember we put it in backwards, pointed out. So we don't want to do that. Hey, honey, I need you to go over there. Thank you. So what you want to do is have them pointed forward. You want to make sure that the tube of your stethoscope is not rubbing on anything, touching the patient, rubbing on the bed rail, the bed frame, you touching it with your hand. It'll give you all these, extra sounds that you don't need. So if you're auscultating with diaphragm, you know, when you're using this for patient care, right? You need to make sure now, I would do this before putting your earpieces in because it's going to be very loud. Warm up your stethoscope and give it a little friction. Because if you warm it up, you're not going to give touch. Who's been touched with a freezing cold stethoscope while you're in the hospital, scared because you don't know what's happening, right? Yeah, and that could be a jolting effect, especially early in the morning. It really doesn't matter what time of day it is, but nonetheless, for patient-centered care, okay, warm it up. Clean hands. If you have a gloved hand, just a little friction, okay, but make sure you have a clean hand. Clean your stethoscope, wipe it down with the Santa Claus after every patient interaction, okay? Um, if you're going into an isolation room, your standard precautions, you maybe utilize a disposable one, follow your hospital, your facility policy and procedure as always, okay? Now, your diaphragm is great for hearing these high pitch sounds, heart sound, lung sound, okay? The bell, by the way, all these plastic covers, they're certainly replaceable. Okay, you can order them on the website, Amazon. You can get them at your local medical supply stores, scrub, wherever they sell them a lot. So these will last you for years. Okay. Mhm. So again, the bell is for softer pitches. Okay, you can listen to the carotids with this. You can listen to um, brewery. You can listen for breweries. Okay, a thrill you feel, but a brewery, maybe a carotid brewery, you can listen to, or maybe it's you want listening to an AV fistula for on a dialysis patient. Okay, you can uh, feel a thrill and auscultate a brewery. Okay. More to come when you get into med surg on that aspect, but make sure, again, always wipe it down. Make sure these are in good working order. If they need to be replaced, replace them, because if these are broken, you can't hear as well. If these are missing or broken, you're not going to hear as well. Okay. And now you can engrave your name on it, all kinds of stuff. But again, just make sure you care for it, wipe it down. Wearing it around your neck, although it looks fabulous, amazing accessory. There is some concerns with the salts of your neck that will actually ruin and harden the tubing. Guilty. This one is hardened from wearing it around my neck for all these years. So little things to learn. If you're going to invest in a good tube, for example, look at this. Look how flexible this part is. This is kind of rigid. It's got atherosclerosis, okay? So again, be careful when you're wearing it around your neck. They have stethoscope holders in your pockets, but essentially it is the pride of being a nurse, right? It's quote kind of like an unspoken rule here. So we want to make sure that we take excellent care of our tools, just like a mechanic takes care of theirs, right? So again, what does stethoscope do? It eliminates all the extra noises and the environmental noises that could surround you and that could impede your ability to listen. If you've got a hairy patient, now I'm not telling you to shave your patient, but it's hard to auscultate over hairy areas. Okay, so yeah, ear with go with caution on that. But when you listen over hair, all you're going to hear is the friction of the hair. So, if you need to shave your patient because you can't auscultate, um, you want to be mindful. It's okay. Right? Um, Never listen through the gown or clothing. It's going to give you a barrier to auscultation, right? Which is really, it kind of defeats the purpose of using it. You can't hear that well over a gown, especially if you're a novice nurse, new graduate nurse. You're still learning. Yeah, we're all learning. We as a nurse, we're dedicated to lifelong learning, right? So it becomes cumbersome, and almost counterproductive if you decide to listen over a gown or clothing. Sometimes you can avoid it. Again, best practice, right? And avoid your own artifact sound, meaning, like I was saying, try not to touch the tubing or have it touch on the bed or on your wrist or what have you, so you don't get all these erroneous sounds. Make sure when you're about to auscultate your patient or even start your head to toe, since my next video will be getting into a head to toe discussion. You want to make sure that the room is essentially comfortable for your patient, temperature controlled. Make sure it's warm. Again, make sure if you're auscultating either with the diaphragm or the bell, okay, that you warm it up. A little friction on a clean hand or a clean gloved hand will go a long way. Don't do no infection control all day long. You're taking your germs and you're giving it to your patient. That's not what we're there for. Do not do that. I watched a student do that, not from the school that I'm at or was or history of, but in general, right? So those are a do not do. Little friction. That's all you need, okay? You want to make sure that the lighting is ample, natural lighting, okay? Try to minimize distractions, interruptions. If they got the TV on, ask for permission to turn it down, right? Or shut it off for a minute. Make sure you have all your equipment with you. Maybe you might need a bedside table, right? Maybe you might need a stool to roll up next to the patient, sit 90 degrees with them, eye level. Even before I auscultate a patient, I'm going to sit down with them. I'm going to do my inspection. Absolutely. And we'll talk about the steps of head to toe examination. But again, this is just a nice video on how to understanding the anatomy of the stethoscope, because this is your tool in your tool bag. You need to invest in a good tool and care for your good tool. It'll last you for years. So again, quick quiz. The ears of the stethoscope need to be pointed towards your nose. See how they're pointed? I can twist them, but I got them to perfect to my liking, right? So pointed, 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 pointed in, okay? And then, of course, if I'm going to listen to a heart sound, anything high-pitched lung sounds, use that diaphragm. If I'm going for a lower pitch, if I'm going to listen for a brewy, maybe even if I want to listen to maybe even a murmur, okay? I can choose this. Infants, pediatrics, except but we're not there yet. Definitely a basic discussion of the stethoscope. And again, remember, wearing it around your neck, the salts will essentially wear out the rubber tubing and make it hard like an atherosclerosis artery, okay? Which is exactly what this has done over the years. But does it work still? 100%. I'm just trying to teach you how to care for it. If you got a nice carry case, utilize that. It'll certainly help you store it, okay? And you may be wondering what that is. I know you looked at it. Mhm. So I keep some extra pieces with me for the stethoscope. I keep some extra ears, okay? Earpieces. You never know when one's gonna break and then all of a sudden it's stabbing you in the ear canal. You don't need that. You got enough problems at work, right? Hey, can you come over here? Thank you. All right, so now something fun to have in the pocket. Um, you can measure circumference of things. You can measure wounds. It is in your metric system and also in standard SAE as well, your inch system here. You can wipe this down. Again, if I need to measure anything that I need to measure. Now you follow hospital policy and procedure on this. Maybe they have disposable ones, paper or plastic that they want to use. Great, but I do keep one with me at all times. I just never know what I'm going to need to measure, especially wounds. Okay. If you're working in the ER, one of those intensive ICU areas, you may need to measure head circumference, or maybe in pediatrics as well, hydrocephalus. The list goes on, but I'm going to try to keep the conversation definitely to where I was going with understanding the anatomy of a stethoscope, proper care of the stethoscope, and just some basic considerations of your head, of the start of your head to toe assessment. Okay. And you need to make sure that again, just kind of reminding you, hey, clean your tools. Every patient interaction before and after your patient, alcohol wipe will work just fine. Okay. You need to, if you're using a bedside table, great. Designated area on that bedside table where you can set your clean equipment and your used equipment, right? Always having a barrier on the table. Now, to some, this may sound excessive, but this is infection control at its best. Okay. And there's a lot of evidence-based practice that will support a safe environment for you, well, for your patient and you, but your patient more importantly, right? Because the goal of cleaning your sanitizing your stethoscope is to create a safer environment, right? We want to avoid nosocomial infections, right? Your hospital-based infections, because those are what create those resistant infections, your MRSA, VRE, multi-drug resistant tuberculosis, right? Um, those are your super bugs, if you will, okay, for lack of better words at the moment. And you always want to perform hand hygiene before you start any type of patient care. But you need to make sure that your tools are also clean too. It is essential. So again, thank you for watching the anatomy of a stethoscope. More quick, helpful tutorials get you through nursing school successfully and to be a competent and confident nurse. Thank you.